The hint of summer is in the air, and after a long, cold winter, many of us are itching to get outside. But how can you avoid turning your outdoor adventures into an actual itch fest? Our next guest is Dr. Clifford Bassett, the founder and medical director of Allergy and Asthma Care New York. Welcome, Dr. Bassett.
Great to be with you today.
So, doctor, tell us, one of the biggest concerns about going outdoors these days is over insect bites, particularly tick bites. What do we need to know?
Well, again, you want to stay bite-free this summer and the spring, of course. And you want to do a little bit of homework, whether you have a child or you're an adult. You want to know what your exposure is. We're not here in the tick season yet, but it's coming. West Nile disease, Lyme disease, and a lot of complications of both mosquito bites and tick bites. Insect repellents. Get a good source of information to find out which is the right repellent for you. There are chemical repellents that have been around for many years. They're safe, called DEET. That's the chemical. And there are natural ones like soybean, botanical oils that do the job, but they don't last as long.
I was going to ask you if those natural ones really worked. I mean, everyone would prefer to use them, but do they really work the same way DEET does?
They tend to not be as heavy duty for hiking, areas where you're going to find ticks. They may be fine for the backyard or from low-risk situations. Again, ticks love us dawn and dusk. And the Wall Street Journal did a review in the past few years in one of their online editions on picking the right insect repellent for you or your family. It was very helpful in trying to provide some background information so people can make the right decision. Regardless of whatever they do, they need to be proactive and use it before they go out. They need to realize that if they're out and about, they need to do a tick check when they come inside. And they also need to know, what are the signs of Lyme disease? What does the rash look like? They need to do a little bit of homework, especially if they've been out and about in a high-risk area.
And don't assume, right, doctor, that just because you're wearing long pants and high socks that you're protected, correct?
That's correct. Not only are we worried about things like West Nile and Lyme disease, but we're also now worried about the Lone Star tick, which is in half the country. If you get bitten by the Lone Star tick, it confers an allergic reaction to beef, pork, and lamb, a meat allergy. And people could be having a hamburger at the barbecue, next thing you know, wind up in the emergency room having hives and allergic reactions. So there are a lot of things that you can pick up from ticks and mosquitoes, and we're out to have a bite-free summer. The number one thing is prevention. Long sleeves, long pants. If you're in a hiking area and you know that there's a lot of ticks present, do the preventive thing. That's the insect repellent before you go out. You could even spray other chemicals on your shirt and clothing. And of course, wipe it off when you come inside. And if you have a rash, see a doctor right away, because Lyme disease and other tick-borne diseases are on the rise, and they're preventable. And that's what this is all about, is keeping safe this summer.
And tell us again quickly the signs when we do have a tick bite. What are we looking for?
Well, you're looking back really for the signs of Lyme disease, which is a big bullseye red rash. But it may be inconspicuous. It may not be on a body part that you observe. That's why doing that tick check is very important. With my patients, sometimes if they're in endemic areas, we'll do a blood test for Lyme and so forth during the season, the beginning part, and we may do it a couple months later if they're exposed to a lot of ticks, and make sure we capture any cases of Lyme disease early. Not all cases of Lyme disease are associated with the rash, but there are symptoms such as fever, headache, aches and pains, and those are telltale signs that you may have suffered from an exposure to Lyme disease or the bacteria in the tick that causes that. Again, mosquito allergies, they're on the rise. We want to protect ourselves. The good news is you can use DEET and other insect repellents for both insect bite prevention as well as tick prevention. It's time to be active and also enjoy Mother Nature. Be careful and understand that Mother Nature has a couple of tricks out there. We also have poison ivy, which is on the rise.
Know. No.
And there are things you could do if you have poison ivy. You can use Ivy Block or other barrier creams to block the oil from getting onto your skin, particularly if you're playing golf or you're going to be in the country or on the woods and you know you're predisposed to poison ivy. Get some of these over-the-counter products that can be very helpful both treating and preventing poison ivy. Again, if you have an allergic skin condition, see an allergist, see a dermatologist, especially have an action plan in place.
Thank you so much, Dr. Bassett. We'll all be pulling out our long pants and shirts this summer for sure. Thanks so much for that.